this is my demonstration for changing a dressing for a central line. In this instance, it is a PICC line. I would start by checking my chart, checking my order, and checking for allergies for my patient, especially allergies to the cleansing solutions. For instance, if I was using chlorhexidine, I've done so and I see that my order looks good, it matches my chart, and that there are no allergies. I'm going to then gather up my supplies. I would get my central line dressing change tray if my facility provided it. I would have sterile gloves. There may be a pair in the pack, but I would bring a second pair just in case I needed them. I would get masks for myself and my patient, and I would get a tape measure for when I'm assessing the site. At this point, I would have everything so I could enter the patient's room, and I would wash my hands and provide for privacy, introduce myself. Hi, my name's Bree. I am your student nurse, and I am here. Can I check your ID, please? Can you tell me your name and date of birth? And they're going to tell me name and date of birth. It matches the order in the chart. It matches the wristband, so I know we're all good there. Provide for privacy. Today I am here to change the dressing on this PICC line. According to our facility policies, that needs to be changed every week. So we are due to get a new dressing on that PICC line. This is important so that we can prevent infection and get a really good assessment on how the site is doing. Do you understand that?
Yes.
Okay, and the other thing I need to let you know is once we're doing this, it will be a sterile process, so it's important that you hold still while we're doing the change. Do you feel like you'll be able to follow commands and hold still for me as we're doing this?
Mm-hmm.
Okay, and lastly, what I need to ask you is, can you wear a mask during the process?
Mm-hmm.
Excellent. Okay, so I'm going to go ahead and wash my hands, and I will put my mask on. Wash my hands again, and I would put my patient's mask on. Okay, and wash my hands again. Now I'm going to get my gloves. Next, I'm just going to do some measurements here. I'm going to grab my tape measure, and I'm going to go 6 inches up from the point of insertion. And then I could flip over to centimeters. I'd be checking against the baseline in my patient's chart to see that it hasn't changed. So the centimeters match what they were in the chart. What I'm watching is I want to make sure that it is no more than a ½ inch difference from previous measurements. If it was, it could be an indication of infiltration or phlebitis or a clot. It would be means to draw attention to it for the doctor, just to make sure that there is nothing going on in that PICC line, or up and around the PICC line up there. Then I would be done with my tape. Now that I've done that, I'm going to just go ahead and assess my insertion site as best I can while the bandage is still on. What I'm looking at is, I'm just kind of checking in here, looking for Rita, if there's any redness, edema, ecchymosis, drainage approximation. I'm also going to palpate here and see, ask my patient, do you have any pain or tenderness while I'm doing this? And patient says no, so that's a really good thing. All right, now that I've done that assessment, what I can do is start removing this bandage, and I'm going to draw it, oh, that's just the sticker. I'm gonna bring it in towards the insertion site. I want that to be the last spot that I pull up the tape. It's weird being around the edge of the box. making sure my patient is doing okay as I'm doing this and trying to do it in such a way that it's not painful. And if this bandage had been on for a week, it might already be peeling up a little bit. That's the other thing, is even if it hadn't been a week, if the bandage was coming off or if it was soiled, that would call for a dressing change at that time as well. So I'm going to keep pulling it. I would make sure that it didn't pull up quite so intensely like that. And then once we're almost there, I'm going to make sure that as I pull the rest of it off that I'm going upwards so that I am not pulling the line out as I pull the tape off. And I'm looking at my dressing for any sort of drainage, and I don't see any on there. So now I can throw that away. Now that it is completely exposed, I'm just taking a look at my insertion to my hub, and everything looks good there. Noting that there are no stabilization devices on this PICC line. So everything looks just fine with that one. Now I am ready to cleanse and redress. So I can take off my gloves, wash my hands. And now I'm going to open my sterile kit. So I'm going to open this up like so, making sure not to cross my field. And then I can take my gloves. I would undo the packaging, and I'm going to open up my gloves. Still making sure not to cross that field that I just exposed. If I had a medical table, I would have it up high enough so that the table was higher than my waist, so my field was not lower. It's just not an option doing the demo from home. Now my hands are sterile, so I'm just gonna go over here to my kit. I'm not gonna need the mask because I did already put the mask on the patient, and I don't need the tape and the gauze, so I can just set those aside. So I'm going to grab my tweezers, and I'm also going to grab my pre-soaked alcohol swab. I'll get that guy opened up, and I'm going to come over to my site. And this is going to be cold. I'm just going to go ahead and clean around here with the swab. According to my facility policy, mainly I'm going around with this alcohol swab to get rid of any drainage, any dried blood around the site, but I'm working from the inside outward. I'm going in circular motions. I'm just making sure that I get it good and clean, and again following policy on how long I do that for. Okay, that one's done. Next I can grab my chlorhexidine and I would pop it, and I'm going to scrub around my site. Again, according to my facility policy, this is for the antiseptic action to make sure that any bacteria that would have been there is being dealt with. According to policy, probably, like I said, at least 30 seconds. So we'll say the 30 seconds is up there. Again, making sure not to contaminate my sterile field over here. I'm gonna grab my skin prep, and I would open that, and I don't those anymore. And I'm just gonna prep kind of in a square around my site. And I'm letting it dry between each time I do those things. And the skin prep is just a good idea to help the bandaging stick over the top of it once I place it. So now the prep is dried. I'm going to, last of all, I'm going to grab my bandage. And we're going to do this in such a way to, again, maintain the sterility of this bandage, being very careful not to contaminate. I would use the larger sized Tegaderm. because my hospital or my facility would have the appropriate size. I unfortunately do not have any more left at home. So I'm centering my insertion point. And putting the Tegaderm down over my pick. I would make sure that the hub wasn't underneath. It would just be the pick line. At this point, I can remove my sterile gloves. And I would wash my hands. I could tape this up if I needed to secure it better and get it in a good position. But it looks like it's doing pretty well right now. Now that it's covered, I can pull this stuff all off. Just making sure that the dressing is staying down and that it's good and connected to the skin. It's laying over where I put the skin prep, so that should help. I can do my initials and date and site or gauge on there and put it at the base here to just hold it down a little bit better, because that's where there's going to be the most friction from patient movement. So that'll help to just kind of hold that in place, but I wouldn't cover the actual site so that I could continue to do assessments on it. Oh, I just drew a blank. Now that I'm done with that, I would clean up my supplies, because that's all taken care of now, and dispose of everything in the garbage. Unless something were really bloody, then maybe it would have to go to biohazard, but that shouldn't be the case. You can wash my hands and remove my patient's mask, put it in the garbage, wash my hands again, and I can take my mask off. I would ensure the patient's comfort and safety, call light bed at the lowest position, make sure there was nothing else that they needed. Modifications for lifespan. If the patient wasn't able to wear a mask due to a chronic respiratory issue or something along those lines, I would have asked them to turn their head away from the site that I was changing, so as to avoid breathing anything on it. If the patient were confused or had dementia, or maybe a child, I would have somebody else available to just help remind them or even hold them so that they weren't moving while I was doing the change, to make sure we didn't compromise the sterility of the site. Other than that, I would leave the room, I would wash my hands, and I would document the date and time and any assessment findings. I would have followed facility procedure throughout the whole change. And sometimes, but along those lines, sometimes the facilities will request that you change the cap at the end of the pick line on the same schedule or routine as when you're changing the dressing. That was not the case with this one, since this isn't even really a pick line. Other than that, that covers everything. I would have been especially sure not to cross my sterile field at any times. Hands would have always stayed above my hips. And that is my demonstration of changing a central line bandage.